Please watch all the way to the end. Don't forget to like and subscribe. Please leave a question or comment at the end. We'd love to respond. Don't forget, please check out our website at www.mypfi.org. So prolapse is basically a turning inside out of the vagina. We talked about this at length in our previous videos. And the vaginal support is lost and the vagina bulges outward. So if you think of the vagina turning inside out on itself and bulging outward, be aware of the fact that there is a set of muscles that sit around the vagina, the pelvic floor muscles, that allow for a little opening through which the prolapse is bulging. That's important to know. So when you think about prolapse as the ligaments failing, the biggest non-surgical treatment for prolapse is do nothing. If you can have your prolapse evaluated and your doctor can sit with you and agree that it's safe, you can safely ignore the prolapse, then you can safely ignore the prolapse and live with it. If it's a nuisance or whatever, if you can handle it and manage, that's the most common non-invasive prolapse therapy. There's devices that can go inside the vagina that kind of act the way an umbrella would act if you go in, not with the spokes and things like that, but the idea is if you go in through a door with an umbrella and you open the umbrella inside the room, it's hard to pull the umbrella back out. So there's a device called a pessary, which is folded and it could go inside the vagina, sit behind the pelvic floor muscles, and then open up on the inside of the pelvic floor muscles. That can actually hold the vagina back in quite successfully as long as the pelvic floor muscles are in place to be able to hold it in. So pessaries work very well as the most effective non-invasive technique for holding prolapse in. If they're overused or used inappropriately, can cause their own set of problems. One of the things they can do is push on the muscles and cause pain. They usually cannot be used in conjunction with intercourse concurrently, so you'd have to take the pessary out to have sexual penetration successfully. And sometimes the pessaries can be so big that they can, or so irritating that they can actually injure the lining of the vagina and lead to bleeding and some other things that are considered to be unfriendly. Most experts, myself included, advise that if you're using a pessary, it should come out and be cleaned and washed and replaced, reinserted, usually at least every 3 months. Some women who are still sexually active decide to leave the pessary in, remove it themselves. If they're gonna go to sleep or if they're planning to have intercourse, they can take the pessary out. When the intercourse is over, wash the pessary, clean it, and put it back in. Most pessaries go along with used with vaginal estrogen to help keep the lining of the vagina lubricated and plump enough so that it doesn't excoriate the vaginal tissues. So the pessary is probably the next step. The other things that have been proposed have been Kegel exercises or physical therapy in an attempt to rehabilitate if the pelvic floor muscles are intact, and you can push the prolapse back in, push the vagina back in, and close that opening of the pelvic floor, the levator hiatus, if you will, the opening to the pelvic floor. If you can tighten around, that tends to be able to hold the prolapse in for some women. If you don't have good pelvic floor muscles intact or good pelvic floor tone, I don't understand or don't see how that could work successfully, but it's been proposed as a method for treating pelvic organ prolapse. So those are the 3 big ones that I know of. To the best of my knowledge, and from a structural engineering point of view, there's no medication that you can use to make prolapse go away or to cure prolapse. The next step would be a structural solution to pull the vagina back into place, and those options include vaginal surgical options and abdominal and laparoscopic surgical options. There are non-surgical therapies for treating prolapse. These include Kegel pelvic floor exercises, as well as pessaries. If the prolapse is not significant or severe and doesn't represent a clinical problem, the prolapse can sometimes be safely ignored. Don't forget to like and subscribe. Please leave a comment or question. We'd love to respond. Don't forget, check out our website at www.mypfi.org. Thank you for listening.